Good day, my name is Jonalyn Tolosa and today I'm going to perform assisting with patient feeding. So, assessment. Number 1, assess that GI tract is functional and determine what type of diet client can tolerate. Number 2, assess client ability to swallow in client with neurological condition. Assess cranial nerves 5, 4, 6, and 7 and gag reflex. 3. Place a tongue blade in the back of client's tongue. Number 4. Determine to what extent client is able to self-feed. Assess physical monitor skill, level of consciousness, visual acuity, and peripheral vision and mode. Number 5. Assess client appetite, tolerance of food, cultural and religious preference, and food likes and dislikes. Nursing diagnosis. Nursing diagnosis is risk for aspiration, risk for deficient fluid volume deficit, feeding self-care, disturbed sensory perception, gustatory, impaired swallowing, then planning. Planning is number 1, expected outcomes following completion of planned procedure. Client denies any biting, chewing, or swallowing problem or food intolerance. Client weight is maintained or changed according to the nutritional care plan. Client complete meals. Client is able to participate in independent feeding. Prepares client room for mealtime. Clear over bed table. B. Set up chair for client and for nurse. Place bed in upright back position if client is unable to be up in a chair. Certain conditions such as pressure ulcer, traction, or spinal surgery may prevent positioning with head elevated. Number 3. Prepare client for meal. A. Assist client with elimination needs. B. Help client perform hand hygiene. And C. Assess client with mouth care. Clients with dysphagia or dry mouth may benefit from clear water rising or swabbing. D. Client with stomatitis, inflammation, or oral mucosa may benefit from rising with a solution containing hydrogen peroxide, warm saline, sodium bicarbonate, or a combination of all agents. Consult with physician regarding an oral analgesic, lidocaine, 2% viscous. Number E. Help client to put in denture and put on eyeglasses or insert contact lens if used. Check that dentures fit properly. F. Help client to comfortable sitting position. If client is unable to sit, turn client on side with the head of the bed elevated. G. Obtain special device and needed supplies to facilitate feeding. 2-handed cup with lid, plate with plate guard, utensil with splint, utensil with enlarged handles, towel before meal. 4. Gator equipment needed. 2-handed cup with lid, plate with plate guard, utensil with splint, utensil with enlarged handles, and towel. Implementation. Number 1. Perform hand hygiene before preparing client's tray. 2. Assess tray for completeness and correct diet. 3. Prepare tray to meet client's need. Open cartons, remove lids, cut food, and season food after asking client preference. Number 4. If client is able to eat independently, stop here, return after 10 to 20 minutes. 5. For client who cannot eat independently, begin operating assistant. A. Put yourself in a comfortable position. B. Ask client about any religious or cultural preference before beginning feeding. C. Ask in what order clients would like to eat. And cut food into bite-sized pieces. And D. It may be helpful for disoriented, visually impaired, or easily fatigued clients to have food identified by location on plate as if the plate were a clock. 6. Feed client in a manner that facilitates chewing and swallowing. A. Older adult feed small amount at a time, assessing, biting, chewing, swallowing, and fatigue. B. Neurologically impaired client feed small amount at a time and assess for ability to chew, manipulate, tongue to form a bolus and swallow. Give small amount of thin liquid, soup, beverage, and assess for swallowing. C. Client with cancer, check for food aversion before and during meal. And 7. Provide fluids are requested. Do not allow client to drink all liquids at beginning of meal. Number 8. Talk with client during meal. Number 9. Use meal as an opportunity to educate clients, like topics related to nutrition, phosphorytative exercises, discharge plans. 10. Assist client with hand washing and performing mouth care. 11. Help client to resting position. 12. Return client tray to appropriate place and perform hand hygiene. Evaluation. Number 1. Observe client ability to swallow. 2. Weight client daily. If nutrition has been inadequate, determine client's tolerance to diet. 3. Monitor client fluid and food intake. 4. Observe client ability to feed self. Okay na.